After a recent sad event, more people are discussing mental health and depression. It's becoming clear how essential these issues are. This is a good opportunity to help everyone learn more about them, especially since there are many misunderstandings about depression. Some believe that if someone is famous and wealthy, they can't be depressed. They think having money means you're always happy. However, even those who seem to have everything can still experience depression. Depression is like an illness. Various factors can contribute to it. For instance, long-term stress can lead to depression, but stress isn't the only cause. Some individuals never get depressed despite being stressed, while others can experience depression without obvious stressors, showing that depression is a biological matter. Our bodies have numerous ongoing processes influenced by our surroundings that can impact whether we might become depressed. For instance, prolonged exposure to high stress levels can trigger depression. However, some individuals can experience depression without a clear cause. They are expected to be happy, but they still feel depressed. It's crucial to understand that depression can affect anyone, regardless of their circumstances. We should be able to recognize it and openly discuss it. Does this happen because of changes in hormones? The answer is yes. And it's not always related to outside factors? The environment has an impact. Our surroundings affect our biology, which, together, determine if someone might experience depression. This is true not just for depression but for other mental health conditions like schizophrenia and autism. While genetics play a larger role in autism, all these factors, environment, genetics, hormones, and our bodily functions interact. Biological, psychological, and social factors are all important, not just psychological ones. So, the biological aspect is crucial here. Because some individuals under extreme stress and in challenging environments never feel depressed. Yes, that's correct. It can happen. Stress can trigger depression, but its impact depends on the intensity and duration of the stress. Sadness versus depression. How can we differentiate between feeling sad and being depressed? Feeling sad or having a bad mood typically fades quickly. These emotions might last for a day or two, maybe a few days. In contrast, depression leads to prolonged mood changes, sometimes with a reason, sometimes without. There's also a condition called bipolar disorder, where moods fluctuate greatly. With depression, low moods can persist for weeks and are challenging to overcome. Depression has 3 levels: mild, moderate, and severe, each requiring different treatments. Treatments for depression. In terms of treatment, suggestions like maintaining a routine, traveling, being creative, thinking positively, and practicing yoga are often recommended to prevent depression. Do these activities truly help with mild depression? They are beneficial. If engaging in these activities improves someone's well-being, they should definitely pursue them. However, depression can make a person feel so powerless that they struggle to engage in these activities even if they desire to. For mild depression, these practices can temporarily elevate mood and bring happiness. But this is not a lasting fix. Until we address the main issues, known as neural mechanisms, things won't improve. While psychology can assist, it's more suitable for milder cases. We can't be sure if those claiming to be cured by yoga or travel actually had depression. When we hear about someone being cured, it's uncertain if they were accurately diagnosed. Depression symptoms can resemble those of other conditions like PTSD, anxiety, or bipolar disorder. Hence, it's crucial to ensure a correct diagnosis, identify the root causes, and determine the most effective treatment plan. Advocating yoga or travel for everyone won't be effective. Each individual requires a personalized treatment approach. Generally, activities like yoga and travel benefit mild depression. Consulting a psychologist is helpful for moderate depression, while taking antidepressants is recommended for severe depression. It varies. Many individuals with moderate depression also use antidepressants, and some with mild depression seek therapy. Even those with mild depression might take antidepressants. Not everyone with depression requires medication or a change of environment. Some find relief with one therapist, while others need more support. There's a stigma surrounding antidepressants, suggesting they induce drowsiness or other side effects. Is that accurate? That's a misconception. Similar to how type 2 diabetes can't be cured and needs management, depression is also managed. Just as individuals take metformin for diabetes management, depression is treated with medication. As conditions improve, psychiatrists can gradually reduce the medication. Labeling these medications as mere sleep aids or addictive substances is incorrect. While there are anxiety medications that might induce drowsiness or have addictive potential, such drugs should be used cautiously. The medications used to treat depression are not sedative or addictive. They aid in improving one's well-being, and since severe depression can lead to suicidal thoughts, it's crucial not to abruptly discontinue these medications. So, depression medications are similar to those for conditions like diabetes. Exactly, they should be perceived in the same light, without any stigma attached. Some claim that becoming depressed is a matter of willpower. Those expressing this view lack understanding. Many believe individuals can overcome depression by taking actions to combat it. They often confuse depression with normal sadness. The reality is that depression has a significant biological component. If environmental factors improve but one still feels unwell, the issue runs deeper. Nobody chooses to remain depressed. It instills feelings of worthlessness and inadequacy. Overcoming depression is not about self-pity. It's about distinguishing between depression and regular sadness. That's a distinct situation. For instance, it's common to label someone we dislike as a psycho. Furthermore, discussions on suicide have been insensitive lately. Such discussions are unwelcome. Self-harm in depression is not merely a cry for help. It's not solely for attention. Seeking attention doesn't automatically resolve suicidal feelings. Should you confide in friends, family? Is it acceptable to suggest reaching out to friends or family if experiencing suicidal thoughts? No, it's not wrong. Seeking support from loved ones is advisable. However, it's essential to first reach out to a professional, as society often judges individuals for discussing such issues with friends. People might criticize and label you as attention-seeking. Yes, seeking professional assistance is preferable. Professionals are equipped to provide guidance. If there's a trusted friend or close family member, opening up to them is an option. Older generations, like our parents or grandparents, sometimes struggle to comprehend mental health concerns, viewing them as a new illness that didn't exist in their youth. Many believe depression is a modern issue and didn't exist in the past. Actually, historical practices were quite different. In the past, individuals believed drilling holes in the skull could alleviate pain like headaches, assuming demons resided within. Bloodletting, a method involving puncturing a vein to release blood, was used for infections and fevers as they thought it could expel supernatural elements. Our understanding of bacteria and viruses was limited 100 years ago. So, did depression exist back then? Yes, depression existed, but the terminology and comprehension were lacking. Considering the significant rise in depression today, can we say it has increased in the modern era? It varies. Today's world is vastly different, offering diverse experiences. For instance, individuals living in secluded villages, unaware of global events, without exposure to distressing news or nearby threats, and enjoying economic stability, might face fewer depression triggers. However, this doesn't mean depression is absent in such places. While triggers may be fewer, depression still persists. When should you seek medical help? For our audience, when is it advisable to seek professional assistance for depression? Different conditions manifest differently. In the case of depression, if you experience prolonged periods of low mood, lack motivation for basic activities, socially withdraw, and avoid social interactions, signaling a significant change from your previous behavior, it's a warning sign. While some individuals naturally lean towards introversion, a stark shift from being social to isolation are feelings of worthlessness that endure. For how long should these symptoms persist? If these symptoms persist for several weeks, 2-3 weeks, it indicates a more significant issue than just stress. Hope exists. Seek help. You are not alone. Keep fighting. Thanks for watching.